Okay, we're really excited to hear from Jen, but really quickly before we do hear from her, we just wanted to do a quick plug. So we are in the middle of a diaper drive. As you know, that one of the biggest challenges that a big piece of the poverty puzzle, especially when we talk about, growing a healthy community and how that starts with, us as women in society. Diapers and feminine hygiene products are really, really in need for our most vulnerable populations. And we are doing a push right now to get a goal of donating 22,000 diapers and 1 month of feminine products for 2,022 women in the year 2022. So if you guys would just use that QR code, that will connect you to the page to donate those supplies. So just a quick plug before we get going on that. So with that, we want to introduce Jen to you all. So we are so fortunate today to get to hear from Jen Fisher. She is a licensed marriage and family therapist with a private practice in Point Loma, where she focuses on supporting couples as they transition into parenthood with everything from maternal mental health, attachment and bonding, birth and trauma and loss, and infertility struggles. I think what's really, really fascinating about Jen is during her master's studies in maternal and family therapy at UC San Diego, she focused on clinical training and screening and treatment of prenatal mood disorders, which combined with her previous experience as in education and nonprofit management make her just an amazing and ideal president for the Postpartum Health Alliance. And we're so lucky that she's here today to talk to us about Postpartum Health Alliance, what they do, and how we can advocate for her. So without further ado, I'll pass it over to Jen.
Oh, thank you. Can you guys hear me? Yes? Okay. So I just need, I need you to allow access so I can share my screen so that I can pull up what I have for you all.
Let me know if that the trick.
Yep, that did the trick. Okay. Can you hear me okay?
Yep, absolutely.
Okay, perfect. I don't know if you want to, I can start my video, but if not, it's not a big deal. It says I need access to do video.
Shoot.
But not a huge deal.
Well, we would love to see you, so let me just make sure that you have access to that. Really apologize.
No, it's fine. Technology is great to a certain extent, right? It's like 2 years into this pandemic and we're still figuring it all out.
Yeah.
Okay. All right, there we go. Here I am. Hiding in a bedroom.
She is Jen Fisher and not Kristen Bernadette. That's me.
Oh, so. That's true. Yeah. Well, I'll take Kristen. That works too. Well, thank you so much for inviting me back. I mean, I know that, gosh, I guess a couple months ago, I got to come and just very briefly touch on what Postpartum Health Alliance does for the community. And God, I probably I think you guys said you have 5-10 minutes and I probably took up 15 minutes and I was just like, whoa, I just spit out a whole bunch of information. And I don't know if I overwhelmed people or if it was helpful or not, but it was just such an honor that you all reached back out to me just to share, more about what PHA does, but then obviously talk about some of the bigger level stuff with maternal mental health. So I was able to I took this PowerPoint that I had briefly used to share with you all last time, but then I thought, I'll just kind of expand on that. So I figure what I would do is I just kind of played off of that, and hopefully some of this might be new news, some of it might be redundant, but my hope is that you all find this just helpful kind of to like look at or follow along with, or if you need to go back to it, that it just feels cohesive and easy to look through. And, I'll be honest, a lot of what Postpartum Health Alliance does is we're an organization, a nonprofit that supports maternal mental health. And a lot of our typical like audience is usually mental health providers or just other birth practitioners. So we have all these presentations and I'm like, woof, like this is not, we're not doing the clinical training here. What can I do to make this easy for you all to follow along, understand just a really layman's level of maternal mental health, and also what Postpartum Health Alliance, or I just say PHA for ease, what we do on a very local level here in San Diego, and then also just things that are happening on bigger levels with public policy and other organizations that are just really doing some amazing, fabulous stuff. So if that's something that interests you all, or you want to go in that direction, I'll give you some of that information too. So I kind of laid out this quick agenda of just, again, our cause, PHA's history, what we've been doing, how we run it, and then again, public policy stuff. So I don't know what this format, like whatever you all want, or if anyone needs to like stop or interrupt or ask me questions, I'm more than happy to. My screen is like fully full of my slideshow. So someone might need to like holler at me and be like, Jen, stop if you do have a question. But we'll go from there. Okay, so with that, so I'm going to start off with just giving a little bit of background on perinatal mental health. This is to kind of help you understand just the difference between why the perinatal period, which is usually around the time you try to start to conceive, through pregnancy to usually up to 1 to 2 years after birth, which is called the postpartum period. So we kind of take that whole timeline and we just call it perinatal. And it's really unique because anxiety, mood, mental health issues that come up during this time period tend to look a little bit different than mental health things that might happen before or after in just different chapters of your life. So to help you sort of understand what that kind of looks like during this time period is there are, for a lot of pregnant people, sometimes in the pregnancy, some mood stuff comes up, some anxiety, some uncertainty. But then after the birth, there's this kind of antiquated term called baby blues. And essentially what that means is usually in that first like 1 to 2 weeks after you deliver a baby, there's just a huge change in your hormones, a big drop in a lot of hormones. There's an adjustment to now taking care of a baby that has 24-hour needs, learning how to figure out the baby's cues. Are they tired? Are they hungry? Do they need a new diaper? Maybe we don't know what they need, but it can feel very overwhelming. So as your body is physically healing, mentally, it's just this huge learning curve. And so there's a lot that comes up with that. And mothers and birthing parents can feel overwhelmed, and they can have a hard time sleeping naturally, because if you have a baby waking every 2 to 3 hours to nurse or to bottle feed, that's going to be very disruptive to your sleep. But also just your change in hormones, just physically recovering from a birth, whether it's vaginal or C-section. I mean, it's a lot on the body. And then just trying to figure out, how do you, you're kind of thrown into now adjusting to another human being and its needs and really kind of figuring that out. So those first couple of weeks, a lot of emotion, a lot of physical and mental and emotional things come up. And that's pretty standard for about 80-90% of new parents. And we call it the baby blues. I mean, it's a silly name, but it's kind of just been stuck for a long time. So we stick with that for now. But then what happens is after a few weeks has gone by and we see parents that are really struggling with their mood, whether it's anxious symptoms, depressive symptoms, maybe they've experienced a really difficult birth and they have some PTSD-like symptoms. And then there's also another spectrum of those that may have bipolar disorder, where they have some manic highs or some low lows. Sometimes parents may not have known they were bipolar until they had a baby. And that's often sometimes the first time they've been around a provider that's like, oh, the symptoms I've been seeing, this shows me that maybe this is something you've been struggling with. And so it's a really interesting time for some parents to initially be diagnosed with bipolar disorder, because that's usually around the early 20s, mid 20s. And that just so happens to be around typically for some parents, reproductive time and giving birth. And then there's postpartum psychosis, which unfortunately is it's a scary thing. It's in a medical emergency. It's where a parent is not in touch with reality and saying things, doing things that don't quite make sense. And that's when there's concern that they might harm themselves or their child. It's extremely rare. It's 1 in 2,000 will be diagnosed with this. But unfortunately, what has happened over the years with the media is often those few times that it happens, media sensationalizes it. And then unfortunately says, this mom was anxious, this mom was depressed, and then she, did these really bad things. And that's not true. Anxious and depressed moms don't do really, really sad and scary things, but the media kind of has twisted that. So there's been this big push of trying to get away from what psychosis has kind of taken over, and really understanding that other perinatal mood and anxiety disorders are actually quite common, even though they're not normal. They're very, very common, but that does not mean that you're a bad parent. So just for ease, for perinatal mood and anxiety disorders, we just call that PMADS in the mental health field, because it's just kind of a mouthful. And for probably the last 2 decades, when there started being research on PMADS, studies were showing that about 20 to 25% of perinatal women and their families were suffering from a mood disorder. But what's been interesting with COVID in the last 2 years is that now that we've had some time, and probably not to anybody's surprise, the pandemic has been hard as hell and stressful for everybody, but especially for new parents, for parents with young children, just the chaos of not knowing, who can come to the hospital of the birth, who can come over and visit the baby, do we need to wear masks, the concern and the stress of being exposed to COVID, and what does that mean for your family? And then also just thinking about those with young kids and having to, find out that daycare shut down for the next week because there was a COVID exposure. So it's just been really, really stressful for families. And some recent studies have just been released that now almost upwards of 70% of parents, moms specifically, have been struggling with clinical anxiety, which, it makes sense, but this is really driving home the understanding of how hard this has been for parents, and that the baseline they had, and then this pandemic, what it's done. So I didn't want to get into the nitty gritty of like every perinatal mood and anxiety disorder and what that looks like, because my assumption sort of was that not everybody's here as a clinical therapist and isn't going to be treating and diagnosing. But I kind of wanted you all to understand, what does that look like during a pregnancy or in the postpartum period if you're struggling with your mood. And this is just a list. Some of it is, sort of, I think most would assume like, yeah, okay, some depression, some shame, low self-esteem, um, just having a hard time with judgment from other people. But then I think what's a little more interesting about this time period is that there's some other interesting, um, descriptions of what that looks like. And oftentimes, what I see a lot with parents is feeling a tremendous amount of guilt that they're not doing it right. They've Googled it all, they've been following all the social media influencers, and whatever they're seeing is not matching up with their real life or how they're feeling. Or just the simple question of like, oh my gosh, you're so, you're pregnant, you're glowing. How do you feel? Aren't you so excited? And a lot of parents do not feel that way during the pregnancy. And then even adjusting to taking care of a baby. Oh, your baby's so beautiful. How's the baby sleeping? How's the baby eating? As if that is a question that would, you know, determine or represent the type of parent you are. It's like, oh, my baby wakes every couple hours. Does that mean I'm a bad mom? Or I've had a really hard time getting the baby to latch, so I supplement with formula. So am I not doing it right? So there's a lot of shame that I see during this time period. I see a big shift, not surprisingly, with just identity, right? Of all of a sudden, I was, maybe I was in school or I was focused on my career and I found a partner, or I'm just really set on being able to conceive without a partner. And I've matched all these steps to do it the right way. And then all of a sudden you're thrown into parenthood, and the shift is so tremendous. The learning curve is so big that there's this almost a sense of loss of control of like, I have had no idea how to do this, even though I've, maybe read the books or Googled everything. Not every child is the same. And so that shift in the identity is so, so big. And then probably not surprising either, that COVID has really impacted is the feelings of isolation and loneliness that parents are feeling. Already they were feeling that pre-pandemic, but now you don't have the parent support groups. You don't have the play date things. You don't know, when you're at a park, do I wear a mask or not? I want to approach this person. They have a child that's the same age of my child, but it's so uncomfortable because you don't know their values or beliefs or just level of comfortability around talking to other families. And so that just isolates families more and just contributes to the anxiety and depression, other mood disorders that are happening during this time period. And one thing at the bottom here that I like to highlight is that when your mental health issues are not addressed, regardless if it's perinatal or not, symptoms can become chronic and they can have a multi-generational impact. And this is significant because this is something that's really starting, providers are starting to pay attention to this when they work with clients, of recognizing that, whatever it's been happening with, maybe this family they're working with, if they look back maybe a generation, 2 or 3, and dive a little deeper and explore, what has that family been through? What kind of support did they get when they had children, or lack of support? What was happening with the parents' moods at the time? Sort of, what kind of support systems were set in place, or what were the expectations? And if you look to that, it sort of gives you an understanding of how there's this trickle down effect. And I see this a lot with clients, is that I have parents come in and they realize, wow, I don't think my mom or my dad were ever diagnosed with a mood disorder, but looking back on it, I wasn't surprised. They were drinking a lot, or there was a lot of anger, or, their mood was unpredictable, or they were just checked out. So this is something that in the mental health field, we've been paying attention to a lot more, is just understanding the multi-generational impact of having a perinatal mood disorder. I like this little graphic. It kind of just shows you a glance of
Hey,
what's
Jen,
happening.
sorry,
Okay,
real quick. Can you reshare your slides with us? We lost visibility of your slides.
sorry, say that again.
We lost visibility of your slides. Could you just reshare those with us?
Oh no. Okay, wait. Can you see this one? No?
I cannot.
Okay. Share screen. Okay, I'm back. Here we go. Share.
There we go. We gotcha.
See
Thank
it?
you.
Okay,
Yep.
good. Okay. So you guys saw this one, yeah? Cool. Okay. So next one. So here is just a really cool little graph. It kind of summarizes some of the stuff I already said, just about 1 in 5 mothers. Unfortunately, a lot of studies have been primarily on women. Unfortunately, white middle class women. So a lot of information is based off of that. But the last few years, there's just been a big push towards understanding maternal mental health. And so other populations have been involved with that. And this graphic is kind of the more recent information when it comes to how does postpartum depression look with Caucasian people, with American and Alaskan natives, as well as Black and Latina. And you can see that obviously with, you know, people of color, that their percentages are significantly higher than even the white population, which unfortunately has been what a lot of studies have been based on for so many years. So this is sort of the most recent info on that, and just showing how, you know, other ethnicities are struggling, and where we're really, really, you know, missing the mark on supporting families in different diversities and ethnicities. And this other part too, which is really sad, is that only 15% of parents actually receive professional help, which is just, it's terrible. I mean, everyone deserves support, but that's a really, really, really disturbing percentage to see that parents are struggling so much and not getting the support that they need. So I'm going to talk a little bit about, well, I mean, this contributes to, why is this important? Why should you care? Why should society care? And so I break it down a little bit. There's different categories. On a parent level, if you're struggling with mental health issue, naturally, life satisfaction is not great. It is hard to function day by day. It's hard to take care of yourself. And of course, it's hard to take care of a child if you can't take care of yourself. And then that in turn impacts a child that you're taking care of, their physical health, their mental health. It has a huge effect on their just entire life trajectory. I mean, this is the foundation that's set usually in the first 3 years of a child's life, are so critical. And so this is a really critical time period for parents to be, you know, at their best level to be able to provide their child's needs. And then if a parent, if there's one parent that's struggling, it's very likely that it's impacting the entire family. So if there's other children or another partner, this is going to affect the relationships with the family. This is going to create a lot of stress within the family, and can create some safety issues as well. And then the last part here is on a very like macro level, we're talking about, how does this impact society? Well, when perinatal mood and anxiety disorders are not addressed and treated, what ends up happening is the healthcare system spends about $14 billion to address the needs later, which costs, about, breaking it down, about almost $32,000 per mother-child pair. Now, if you look at that number and you think, gosh, if you could just take that, or even half of that, or a third of it, and push it towards more preventative measures and supporting this parent and screening them and getting them mental health resources, that would significantly change the amount of money that society is spending to then address the issues later in families that have been affected by by PMADs. And then this little slide here kind of just breaks down more of the percentages of PMADs on parenting. All of it is just basically, I don't have to read every percentage, but you can see there's big chunks here of how struggling with a mood disorder while you're a parent, you're not going to be breastfeeding as much, or you won't do it as long. It's a struggle to keep routines in the house, less likely to read to your baby, or talk with them. Oops. To do that, let's go back. Oh, technology. Less likely to read and talk to them and engage with them, and then less likely to play with them. So that's how babies learn. This is how they learn who's safe. This is how they develop their first relationships with their caregivers. And this is how they build their sense of trust, safety, attachment, as well as just building their own vocabulary and understanding language. So if you're struggling with a mood disorder, it's going to be really hard to build that attachment and attune to the needs of that child. So the impact that we've seen on children is that there's different levels here. When you're pregnant, you're more likely to have, if you're a parent and you're pregnant and you're struggling with a mood disorder, you're more likely to have IUGR, which is intrauterine growth restriction, which just means the baby is not growing to the full potential that it should be. So that automatically puts you in a high risk category. Then there's preeclampsia, which is high blood pressure. You're more likely to have gestational diabetes. And then the baby is just being exposed to stress hormones as well. And then after birth, oh, Kristen, are you talking? It says you're talking.
No, you're great. You're talking.
Okay. So then as a newborn, what we see is the impact is oftentimes with a mood disorder is that that baby will be born prematurely, which puts them at higher risk for being admitted to the NICU, having a harder time with breastfeeding or even latching onto a bottle, and other health issues. And I mean, that in itself creates significant stress for parents as well. And this can create some instability too with securing that first attachment, having that baby feel safe and connected and feeling calm around parents. And then as we get to a little bit older in children, when a parent has a PMAD, they're more likely to be overweight. They're more likely to have, mood disorders themselves. They struggle in school. They have poor social skills, more likely to, have risk-taking behaviors and substance use as well. And then as an adult, as we see that play out even more, there's just a whole host of medical conditions that are likely to happen when you've had a parent that struggled during their pregnancy or in the postpartum period. You're likely to struggle from health issues, high blood pressure as well, mental health issues, problems with relationships yourself, and more likely to be, having substance use addiction problems as well. So this is significant. This isn't like mom or dad, we're really struggling in that first year or two of my life, but everything will be fine. But, and not to say that children aren't resilient and families aren't resilient, but what we're seeing after a few decades of some research is that you're not setting up these children for success. And that unfortunately, this is sort of the trajectory of what can happen to adults when they had a parent that was not being supported with their mental health. So with all that background on maternal mental health or perinatal mental health, I wanted to kind of lay that foundation so that you can understand why Postpartum Health Alliance PHA is here. We're a nonprofit organization that's local here. And we do what we do because we recognize that perinatal mood and anxiety disorders, they're not recognized, they're often underdiagnosed, they're very treatable, but there's still some stigma there, right? I mean, I think we've come a long way with mental health. People are much more open talking about their struggles. I mean, even in social media or actors or influencers, you'll see people share about their struggles, and I think that's wonderful. But there's still this really, the perinatal period is still kind of a touchy subject because people don't like thinking about the fact that a mom or a birthing parent or families are struggling. It's just a scary place to go. And so people don't always ask the right questions. Providers don't ask the right questions. It's much easier to just say, how's the baby doing? Are they eating and sleeping? Okay, great, moving on. And they're not addressing the needs of the parent. So PHA is here really to educate, train, help families and providers understand how important this and critical this time period is. Like I said earlier, PMADs are common, but they're not normal. And this is something that is frustrating as a provider because I hear clients tell me other providers just are very dismissive. Oh, well, yeah, of course you're tired. You have a baby, or, this, get used to this. It's not going to go, it's not going to be easy. This is what it's like being a parent, but it's so undermining. And it really makes you feel like, is this is how I should be feeling. If you're really struggling for weeks or months or even a year, that's not how it should be. But I think that sometimes, family or friends or providers can be very dismissive, and that just compounds the struggle of dealing with a PMAD. But it's so treatable, and there are providers that are here to specifically work with families and understand their needs. And so PHA has been around here locally for about 20 years doing exactly that, trying to meet the needs. And I'm not going to read every little bullet point here, but just to kind of give you a glimpse of what our organization does locally. And around 96, there was a couple of providers, doctors and reproductive psychiatrists that really recognized that there needs to be some more attention paid to PMADs and how to support families here locally. And then one of the founders, Jane Honigman of Postpartum Support International, who we sort of look to them as like a mother chapter. They're this international organization, and we're just sort of the local San Diego chapter of what they do. We don't have any financial ties to them, but we really model on a smaller scale a lot of the things that they're doing with their trainings and scholarships and just the education and awareness. But one of PSI's founders, Jane Honigman, came down here and met with some providers, and that's really how PHA got established here. And then, we sort of grew along the way. There was times where we had these I don't know what to call them. They called them crib notes. They were like flyers about what's happening in perinatal mental health. And it usually involved some kind of media sensationalized, story about a mom struggling. And if you see in 2005 here, the book called Down Came the Rain was released. And that was Brooke Shields' book. And she was kind of one of the first famous people to say, I really struggled with postpartum anxiety and depression, and wrote a whole book about it. And then it became even more sensationalized because then, what's his name? Oh my gosh, Tom Cruise goes on national media and basically says that, she doesn't know what she's talking about. There's no such thing as postpartum depression and anxiety, and just calls her out on being a bad mom. So there was a lot of attention to maternal mental health at that time. And I feel like things were starting to pick up a little bit more and just people paying attention to it. And then that obviously helped our organization grow over the years. We eventually in 2012 hired our first part-time paid person. I mean, we've been run by a small board of volunteers for a long time. And then we realized the needs were pretty significant. We formed a membership and people paying dues to be able to get access to our trainings and be listed on our directory to help families identify who are safe providers in this community that can support families, who are trusted referrals. So we created that directory as well. And then we had we had a consultant come in 2016 to do some pretty significant strategic training and planning with our organization to really help us hone in. How do we want to help the community? Where do we want the needs to be met? Where do we want to focus? And that's where we made a really big shift towards training providers, helping them understand that this is an important time period. Families need to be screened. They need to be provided education, and they also need referrals. Don't just give them a checklist and say, are you anxious and depressed, and fill out a questionnaire, and based on your rating, they're like, oh yeah, okay, looks like you're anxious. Good luck, go find a provider. No, now, it's become really critical that your OBs, your midwives, ideally your family medicine doctor, primary, or even the pediatrician who sees families so often during that first year or two, they should be screening parents. How are you doing? What's going on? You're struggling. You're having a hard time with this. Okay, here are some resources. Here are some referrals. And if you see in 2019, California eventually made a shift with some of their public policy and requirements and trying to get providers to recognize it's really important you screen parents. Not all providers do it, but it's a recommendation by ACOG. And so it's slowly moving, but that was a huge shift for our organization, is for other providers in the perinatal period, which are typically the ones that do delivery, right? The OBs and the midwives, recognizing we have to assess for mental health. We can't just do the physical part of prenatal care. The mental health goes hand in hand. And so there's just been a significant jump in the needs of our organization, where providers are like, okay, I screened my clients, checking the box for some mental health stuff. Now, where's the handoff? And so PHA has grown significantly with that and the need of the community, which has been really, really exciting for us. So this is something I always like to do with, I do this with clients, but it's also really nice to do this with, providers, with, families, with just anyone in a general presentation of understanding that who's at risk to having a PMAD. And this is actually just a short list. There's a lot that goes into, are you at risk for, maybe possibly having a PMAD during the pregnancy or after? And I won't read all of them, but, if you have the chance and can look through them, it's really helpful to really start to check off. Oh, wow. Yeah, I have a personal history of mental health. I've been through infertility. Oh, I have perfectionistic issues where I shouldn't call them issues. I've been a perfectionist and I've really done well in school and my career and, running marathons. But now all of a sudden, these perfectionistic traits are not helping me be a parent. And in fact, they're getting in the way of my bonding. They're making me feel like I don't have this under control. I see perfectionism so much in my clients and really having a hard time with recognizing that it's not about being that perfect parent. It's about being just good enough for your child. That is truly all that your child needs, is a parent that is just good enough. That is a realistic expectation or standard. But a lot of parents struggle with that. I mean, we have so much access to all the things that we should know. Why wouldn't we be the perfect parent? But that really, really ends up being a double-edged sword, where it makes it much, much harder to that adjustment and that identity that I mentioned. And then probably not shocking, psychologically, if this was an unplanned pregnancy, which for 50% of pregnancies, they're unplanned. They're not always desired. It kind of comes as a surprise. And so that can be a very hard adjustment to recognizing, oof, like, is this the time? What do I do? How will this affect my life and my relationships? And then just other things too, psychologically, obviously having a baby in the NICU. Oh, another big one I see a lot in practice is mothers that have a negative relationship with their own mother. This is huge. This is such a triggering time because now you start to think about, if you're a mother and you're pregnant, and you start to think about your own childhood and maybe how your mom treated you or how she's currently treating you. And if it hasn't been great, this is really, really hard because as a parent, we're looking to others, right? We should ideally have this village that tells us, we'll support you. This is how you do it. Oh, yep, I've been there. This is hard, but let me help you. And if you don't have a great relationship with your family, but specifically your mom, I see that this is a really difficult time for mothers and fathers that have strain within their own relationships with their parents and thinking of their own childhood and how that can bring up a lot of triggering memories, disappointments, and just sadness about what they didn't have when they needed it. And then some other things too, I'll just highlight, it's just some environmental, social, societal stuff, not having support, maybe geographically, right? So many people don't live near their, where they grew up, or they moved away for college or took a job in a different state. And so they may not have family support, or maybe they've had death in the family. Some really struggle with, some babies are just really hard. They're really difficult temperaments. They're very sensitive. And that can be so triggering for a parent who doesn't understand the sensitive needs of that baby, because comparing it to their friend's baby, well, gosh, that baby eats so well, or how come that baby naps longer than my baby? And so the temperament thing, that can be so hard too, and triggering. So looking at this list, you can see, I mean, it's not even the full list, but you can see how there's a lot of factors that can happen that sort of set you up, and that really should be paid attention to while you're pregnant, to say, hey, these are some things that might come up for me. And ideally, how wonderful that would be during your pregnancy, or even before, if you're actively trying to conceive, how lovely that would be to recognize, hey, I have a history of some of these things. Maybe I should work through that so that I feel better prepared to go into a pregnancy and a birth and the postpartum period. So the mission of what PHA does is essentially, we are trying to help the community recognize, understand, and respond effectively to the mental health of pregnant and postpartum individuals and families here in San Diego. And the way that we do this is a couple different sort of pillars of how PHA runs. Like I mentioned, we're a 501c3, we're a nonprofit. So, we run on pretty bare bones. We've got that one paid staff member, and then we've got a working board. And what I mean working, they're all volunteers, but we really dedicate our time to addressing the needs of the community and helping run the internal programs of PHA. So we do this by having that provider directory, which is primarily mental health providers, therapists, reproductive psychiatrists, some OBs, midwives, as well as some other sort of birth workers. We call them kind of allied. They might be chiropractors, doulas, lactation support. So we sort of vet them. We give them access to education and trainings. And then they're on our provider directory. That way, when families come to our website and they're looking for a provider, they can search by insurance, they can search by specialty, or by area, and find who they need. But we do have families that often feel just overwhelmed. They don't know what they need. They just know that they're having a hard time, or sometimes partners will call in and say, my wife's having a hard time, or my husband's really struggling, and I don't even know where to go. So we have a warm line. It's essentially, it's a helpline. It's a 24-hour voicemail box that gets checked every day by our peer support specialists. These are trained, um, just trained people. Most are not even, they're not mental health. A lot of them are actually just parents that had their own struggles, and they kind of came through on the other side and recognized that they wanted to give back. So they go through a basic training and they learn how to provide really basic peer support, validation, and helping parents understand, you're okay. I'm so glad you called. Give me some, little bit of background info on you, and I'm going to help you find some personalized referrals through our directory, and I will shoot those over to you. And if you need more help, then call back. So that's a big chunk of what we do that we offer to the public for free. And then the PMADS education and awareness, it's on our website for families, but like I said, we offer a training. We have our own training we've created. It's a 3-hour course for providers that helps them. It's just a basic introduction to what perinatal mood and anxiety disorders are, how to screen and refer. And that's part of our membership for our members. And yeah, so that's kind of a big chunk. We do the training part and education to providers, but then we support families by connecting them with people on our directory and providing that peer support to them. And for a lot of parents, that is just so validating when someone can say, you're doing okay, you're doing a good job. I'm so glad you called. I'm so glad you reached out. There's support, and here it is. I mean, that's just, that in itself is tremendous, of having that peer support. This is just a quick glance. I want to show you, this is our new board that joined. Like I mentioned, all of these lovely, lovely women they give their time for free and volunteer with the organization. I can imagine very similar to how you all are run. Just a bunch of really badass women that just care a lot about perinatal health, family health, and have dedicated their time to supporting the organization. And honestly, there's just no way. I mean, like I said, we have our one paid staff person that does a lot of internal operations, but PHA wouldn't be what it was without these really lovely women. So I always love to give them a little bit of credit too, and highlighting them. And they're just fun. That helps. And so one last thing, just when it comes to PHA, is how we're funded. So our providers, the therapists and others that I mentioned in our directory, they all pay dues. So that gives a chunk of our budget and helps us sort of, helps operationally in a lot of things that we do. The board also has board dues they have to contribute. We also in the past have done fundraising and events, which unfortunately with COVID, we put that on hold for the last 2 years, but we're hoping this year to do a couple of maybe informal events, and possibly look back at doing another. We used to have an annual formal event where we do an auction and food and dancing. So we might look back into that, but that was a source of funding. But then a good chunk too, which has been really cool over the last few years, is grants and donations. I think there was just a really big shift in awareness and understanding, and shifts in public policy, and just recognition of the needs of parents and their mental health. So with that, we've been able to apply for some grants, which have been awesome. Specifically, the Kaiser Foundation has, over the last 4 years, really liked some of our programming and what we've done. So they've given us a really nice chunk of our budget to support our operations, to support scholarships for providers of color, to support helping other families get access to care, as well as giving our trainings out to other providers, and just really helping push our reach in the community. And then we obviously have some, individual donations as well, which just as a, I like to say, I mean, grassroots, but I mean, we've been around 20 years, but just even the smallest donations, they really do make such a difference in the way that our organization operates, just on our small local level. So that's the quick gist of PHA, maternal mental health. I know when talking to Kristen, we touched base about just some, in addition to like the local level stuff, there's obviously like larger level organizations that are doing some really amazing things. And I wanted to just briefly highlight them. But what I thought would be helpful to share is, okay, I tell you all this stuff and it's like, great, so what do we do? This seems overwhelming. There's a lot that goes into supporting families. And I put this slide in because it made me think about just like what families are dealing with, the mother load right now. Well, they've been doing this for forever, but especially in the pandemic, of everything that parents, but especially moms, are taking on that is just emotionally, physically, mentally so draining and hard. And you could tell a parent, oh, you just need a little bit more self-care, go take care of yourself. But you know what, a coffee at the coffee shop, or a massage, once a month, or I don't know, buying yourself like whatever, a new outfit, that's not going to cut it for parents and self-care and helping them get to their needs. There's just bigger level stuff that needs to be addressed and recognized to help parents so that they feel like they have some kind of control and support around their mental health. So what I listed here is that when it comes down to is we need providers, and this is, all providers in the healthcare system, to be recognizing, to know how to screen for mental health, how to educate, give some basic information, and then refer to the appropriate provider. But then with that is, okay, cool. I got a recommendation. My doctor says I need to go see a therapist. Well, now the next step is we need access to affordable mental health care, specifically therapists that are trained in perinatal mental health. But just the fact that there's such a barrier with mental health, insurance companies don't want to cover it, or they just have all of these, all this red tape around, okay, well, we'll do individual therapy, but you have to have a diagnosis, or no, we won't cover, we won't cover couples therapy. But go ahead and try to submit a super bill and maybe we'll reimburse you a partial amount. I mean, it's chaotic. And every family that I've worked with that tries to use insurance, it's not across the board. I mean, every single one is different too, which is just such a struggle. If you're already having a hard time with your mental health, then just the process of navigating the healthcare system, so many families are like, I give up. Like, it's just not worth it. I can't afford it, or I can't pay out of pocket, or it's just too hard to navigate and I give up. And to that as well, what we've seen is now the mental health field is really struggling too. They're burnt out. They don't have as much, there's just not as much availability for consumers, because the providers that we have are just stretched so thin that they are having a hard time keeping up with the need. And so that's hard for families as well. They're just, I've had people say, I reached out to 10 therapists, nobody has availability. I don't even know where to go or what to do. And so that is so defeating in itself. And then at other bigger societal federal levels, what we really need, what parents really need, is they need paid family leave. They need affordable childcare, right? They need a safe place that they know their kid can go to so that they can maybe go back to work. They need equal pay. They need work to actually be flexible, which I do think there's been a little shift there with the pandemic, only because a lot of people had to go remotely and a lot of businesses had to be flexible with that. And so that is helpful, that people are recognizing, oh, you're at home and your kid had a COVID exposure and I see them in the back there. And Okay, well, as long as you can get your work done, great. But there's still a lot of businesses that are not flexible with that. Or maybe they're letting parents work remotely from home, but then they don't understand when they have a child come home because their class shut down for the week. They're still expecting, well, you still have to do, the same work requirement while you're also taking care of this child at the same time, essentially doing two jobs at once. So these are some of the bigger things that need to be addressed to support, the mental health of parents. And I wanted to add this slide, and I don't know if it'll be helpful. Chris and I can always send you an email with the names of all these organizations. But if you all are looking to advocate, promote education, change public policy, change things on a very, on a federal level to support families, these are the organizations that are doing it, and they are hustling and they're working so hard. And there has been in the last couple of years some really awesome public policy changes that have happened, and they're doing the work. So I encourage you to look into them, follow them on social media. They're always announcing, come sign this, come support this, come show up here. They're doing some really, really wonderful things on a very high level. And so I wanted to share that part with you too. And I think I just have one more slide. So I thought, you're not a good president of a nonprofit unless you do a plug for how can one help and give back, at least at your local level. So what I encourage you all to do that listen or hear this later on is reach out to your providers. Go to your OB or your primary doctor or your pediatrician and say, have you heard about PHA? They have this education and training, but also if you have families that are struggling, you can send them there. They are resources that can support families. And then if you're interested on, kind of becoming a little more involved with PHA, sort of on a more close level, we have our warm line, like I mentioned. You can do our training. It's a self-paced little webinar on becoming a peer support specialist, and kind of helps you get set up. And doing that, you're usually on call for a week, and then you have a backup volunteer, and that's when you answer those phone calls, the voicemails that are left, and you just support parents and help them find resources. And we have a really great, like I said, warm line group that is really, they're just amazing. I mean, we couldn't do it without them, and they're just so dedicated. I mean, giving back to the community, it feels good for them. And like I said, a lot of them are parents that have had their own struggles and came through and just said, I want to give back. And, maybe I'm not a therapist or psychiatrist or doctor, but I know I can talk to a parent and be like, it's okay, and here's some help, because that's maybe something they needed, or maybe they got it and they're so grateful for that. So that's a way. And then the advocacy, like I mentioned in the previous slide, support them, follow them. They're the ones that are doing that big, macro level type of work. And then of course it's, donations. They keep things going. They keep, the lights on and helping us do what we do and further our reach. So that is my, I think that's it. Yes. That's all I got for you
Amazing.
all.
That was amazing, Jen. Thank you
Oh
so much.
gosh, you're so welcome. I hope that was helpful. I'm gonna
Absolutely.
stop sharing my screen. Let's see here. We'll figure it out.
We just really appreciate your time, and wow, I mean, Postpartum Health Alliance, I think, is just such a cool organization, and it's amazing how I feel like it really hits on both that provider level and the individuals within the community, and kind of helps reach both of those, simultaneously. It's just really, really a neat organization, and such an important. I recently became a mother. I have a 6-month-old, so I
Oh,
totally
congrats.
understand. Thank you. The importance of all this. So thank
Well,
you so much.
I hope you feel supported.
Thank you very much. Well, so we'd like to open it up to everyone. So if you guys want to use the chat to ask questions to Jen, we can go through that way. And so I'll give everyone a second to kind of generate their questions and come up. We still have some more time to have a wonderful opportunity to pepper Jen with all of the questions that we have. And I also have just a couple of my own kind of as we get going here while people are thinking of all their good questions. Really appreciate you sharing, and we'll definitely follow up with, all of the advocacy organizations that, you think that we should support. But I'm just curious, what is there, kind of a, besides just, connecting postpartum parents with healthcare, is there like a goal, an end goal that you're trying to obtain for maternal health as an organization?
Gosh, I mean, big goal is that every family recognizes the importance of their mental health, right? And I think that, I already mentioned mental health it's been stigmatized forever. There's been some movement there, which is great. But like I mentioned before, when it comes to the perinatal period of being pregnant or having a baby, it is very taboo to say, I'm not loving this. I'm having a hard time. I don't feel good, right? And so parents need permission to be able to say those things, feel those things out loud. And, just expecting them to do that is we're just going to drag our feet. And that's really where end goal we need on a federal level, but then on a, state level, and you work down the systems, we need providers who are, considered experts, right, on whatever their healthcare profession is, to be able to say, how are you doing? I did this basic screening. I'm going to talk about this a little bit more. And it's really important that we address this, right? Because that's when I feel like families will be like, oh, well, my doctor or my pediatrician is saying this is important. So if they say it's important, then that, it carries a little bit more weight than, I don't know, some mom influencer you're following on Instagram. Like, I just, that's helping. But at the end of the day, we really need these healthcare providers to incorporate that within their work and talk about that and make space for it. And so ideally, if every provider that comes in contact with a family, whether that's an OB, midwife, primary, pediatrician, we love for all of them to recognize the importance, because they're the ones that are going to be able to give that time with a family member and recognize this is important and you need to pay attention and we can help you and let me connect you, right? That will have I think the greatest trickle down effect than, us trying to like buy some commercials on TV or like post some ads on Instagram. It's just, it doesn't have the same impact as, unfortunately, a healthcare provider who's considered an expert again of saying this is important. So I guess that would be the big end goal, is having families get this education, understanding through their providers.
Yeah, they really are frontline workers to this problem, huh?
Yes, they are. God, they're doing so much too, but
they have that access. Amazing. Well, I'll open it up. Does anyone on the call have any questions? And again, you can pop those questions into the chat.
So we have on the Q&A, Alex asked if there's a bill that's currently on the table that PHA supports that we should know about. And I think from a junior league perspective, that's, generally at the state level, but certainly if there's something at the federal level, we should know about as well, or local level. Go for it.
Yeah. So what's been great is actually in the last couple of years, well, like right before the pandemic, there was some bills that were passed, which was just like awesome. Just being able to have maternal mental health, like federal funding, screening, insurers starting to understand that they really should be supporting this, as well as, encouraging providers to start doing the screening. Now, again, it's a recommendation, but it's not mandated. So not all providers are doing the screening, but it was significant movement. And then the pandemic hit and a lot of stuff really kind of stalled. But currently, there is, with Biden's Build Back Better Act, within that is the Moms Matter Act. And that is, it's been approved by the House. It's just waiting on the Senate. And it essentially, some of the things that it addresses is what we talked about today, just providers recognizing the importance and that money needs to go towards it so that they actually will get training, get education, they'll actually screen, be able to refer, spend time doing that in an appointment. But then another big part of the Build Back Better Act is that they're trying to address universal pre-K and childcare, which, a lot of people have a lot of feelings around that, either side. But what we're starting to see, especially with the pandemic really intensifying this problem, is that when you don't have reliable childcare, then you can't work. You can't take care of your economic and financial needs. You can't contribute to society in maybe the way that you were before. Maybe I can't even tell you, I forget the latest number of how many millions of moms left the workforce in the pandemic because they didn't have the support systems they needed to take care of their children. So this is part of the Build Back Better Act, is the child care component of it is so critical to the economic support and success of families, which in turn affects the mental and emotional state of these families as well. But then, like I said, within that's the Moms Matter Act, and that addresses very much more specific maternal mental health issues, and all the other healthcare. I mean, I don't know if you all have read about just the maternal morbidity rate in the US. I mean, for being a Western society, we have moms dying after childbirth higher than any other Western country, and it's really disgraceful. And then you consider just the other additional layers of economic status, racial status, ethnicity, and it's significant. I mean, the needs of our families that aren't being met. So hopefully with this act and some of it, will get approved, that we can meet some of these needs. So that's kind of the current thing that's just been hanging and lingering. So we'll see.
Thanks, Jen.
Yeah.
Well, I have another question that I was thinking about. When just you kind of when you were speaking about kind of some of these populations, are there different communities that you see like in your practice that struggle the most with postpartum challenges?
Gosh, yes. There's so many levels of different, I guess, types of struggles. There is no doubt that families of color, whether it's Latina, Black, Native American, Asian, those ethnicities are unfortunately not getting their needs met on several levels. One, there's just the recognition of, or not recognition, more dismissive. Providers, practitioners are very dismissive of helping other races, because a lot of healthcare is dominated by primarily white males. So those patients are often dismissed or thought of as their problems aren't as significant as others. So they're obviously not being screened, they're not being assessed, and they're not being referred to treatment. But even those that are, the problem as well is that in providers, whether it's, during your prenatal care with the OB, midwife, or family practitioner, but also on the mental health side, is we don't have a lot of providers that are providers of color. And so if you think that, I'm Asian and I don't trust my doctor because he's a white male and he's saying I need some support, but I can't find an Asian therapist. So there's a lot of mistrust within the healthcare system. And so that is, I think, again, another one of those big macro levels, is that we need to find more providers on all different levels, but especially within mental health, to be able to look like the rest of the population. That's like a really general answer to that question. The trickle down of that is just, it's significant. We need more training, we need more visibility, we need more providers on all levels of all different ethnicities, races, abilities, how they identify with gender, sexuality. It needs to be the full spectrum, and we're really lagging in that. And that's, I think, a big part of what gets in the way of families not getting the treatment that they deserve, or, can feel like they can connect with. So it's a level of mistrust within healthcare, for sure.
So we have another question in the chat from one of our junior league members that is pregnant now, and she's wondering if there's anything that she can do beforehand to prevent postpartum mental health challenges.
Okay, good. I always have thought, like, I know it's a little outdated, but some, or maybe not outdated, maybe it's just not the norm as much that I see being a marriage and family therapist. But there was a time where people would do, pre-marriage counseling, and it was really a time to kind of like touch on topics of things that might be sensitive, or at least should be brought up. And it could be like, ooh, this might affect our relationship. Well, after we have this wedding, that does not mean everything's going to be perfect. But I like families to think about that too, whether they're trying to conceive, or they're thinking about it, or they're pregnant. This is such a great time to do some work. And I think it's hard because, again, we don't want to admit that we're having a hard time with things, or maybe we're not. Maybe you're pregnant and you're feeling okay, but you want to feel a little prepared. And I think it's the same idea as premarital counseling, is that there's nothing wrong with kind of looking and getting some additional support from the mental health side, right? Just like you go to do your prenatal care and do, the physical exams and the blood work and all those physical things that are addressed. The mental health part is so significant to the health of your baby, and how that birth and delivery and attachment will pan out. And looking at just the risk factors list, the slide that I had, and finding, ooh, yeah, I have a history of this and that. Maybe I could go in and do a little bit of work ahead of time to better prepare myself. And I find too, sometimes it's really nice to work with pregnant clients, because we start moving a little bit and they think, well, I dealt with this, but it's not really a big issue. But then it's really cool when I see parents then, after, in the postpartum period, we've already built a foundation of trust and safety, and just recognizing like, ooh, do we think that maybe this is coming up a little bit for you? And it's just really nice to have that already set in place, as opposed to, waiting weeks, months, maybe a year down the road, and just be white knuckling through, your adjustment to parenthood. and then diving deep and just maybe some things that are hard, right? Like, so I don't know, it's almost like I like to think of, if you're pregnant, great, do some almost preventative work. And in fact, bring your partner in and start doing some work together about what are your expectations, about how do you want the birth to go? How do you want to parent? How do you want, family to be involved? Because it's really interesting when things sort of come up and you're like, oh, well, this is how I was raised, and we're not going to do it the way your parents raised you because they're crazy. Or, it's just like all of a sudden that stuff starts to come up, and that can really make parents, especially new parents, butt heads, is recognizing like, oh, we came from different childhoods and we're not clicking on how we're going to, do XYZ with our child. So it's just nice to be able to work with couples together and just be like, this is the best gift you could give your child, is to sit down, work together as a team, maybe work through some of your own things. Everybody's got something, and that's nothing to be ashamed of, but it really is the best gift that you can give a child, is to do your own work and work as a team together. So anyways, I think when it comes to clients, I love doing that stuff, and I always love bringing the partner in. So it's fun.
My husband and I did pre-baby counseling, and it was awesome. It was very fun. Yeah, loved it.
That's good to hear. That's so good to hear. Yeah.
All right. We'll give one last shout out for any questions. Nothing. All right. Well, Jen, I just want to say on behalf of everyone, thank you so much for all the information that you provided us today. And, it was just really amazing. I think just learning about your organization, but, as I think we kind of said in the chat, it's just so fascinating that, multi-generational impact that, this is going to have on society and getting ahead of maternal mental health. So thank you so much for sharing with us. We definitely, all here will be advocates for your organization and for your cause, whether it's on a local level or, a federal level. Really, really appreciate you educating us today.
Oh, well, thank you. I appreciate you guys inviting me. And, like I said, I could talk about this stuff all day, but it really is. It's a pleasure. And just really, you guys are doing wonderful things too. So thanks so much for letting me share a little bit about the PHA world.
Yeah. Thank you. Have a great night.
All right. You too. Bye.
Thanks so much. Bye.
Thanks.